Artificial disc replacement has been around for more than 10 years, but at DISC we're very excited to be able to introduce the next generation artificial disc, and that's the M6. The M6 artificial disc replacement, it provides both shock absorption as well as range of motion that replicates the natural disc in the human body. Patients that are the best candidate for an artificial disc replacement are typically those patients that have failed conservative care. They commonly have both neck pain and arm pain radiating from the neck from either a pinched nerve or a stretched nerve. An artificial disc replacement involves a small incision in the front of the neck, and from there we remove the disc or the offending agent that's compressing the nerve, and then we put an implant in that again replicates the normal motion of the neck, and it replicates the natural disc of the human body. It's an outpatient surgery, which means that you'll go home the same day. Typical recovery is approximately 2 weeks to 6 weeks, with a return to work at approximately 2 weeks, but full recovery typically takes 6 to 8 weeks.